All right, tonight in Medical Rounds, it's one of the leading causes of cancer-related deaths in the United States. We are talking about colon cancer, and here in Connecticut, about 3,000 people are diagnosed every year. Joining us live now is Dr. Vaibhav Mehendiratta, a gastroenterologist at Hartford Hospital, to tell us more about prevention and screenings to help bring that number down. We thank you for being with us tonight, Dr. Mehendiratta.
Thank you for having me.
Well, we understand March is Colon Awareness Month, Colon Cancer Awareness Month. What should the general population know about colorectal cancer?
Like you said, colon cancer is a common and lethal disease. It is common in people over 50 years of age, with more than 90% of the cancers in older population. Males have a higher risk of colon cancer than women, and African Americans have a higher risk of colon cancer than general population.
We hear so much, doctor, about preventing cancer or ways to prevent cancer. Is there anything we can do to prevent colon cancer? Is diet critical?
Diet is very important. There are current recommendations to limit obesity and increase the amount of physical activity, limit red and processed meats in your diet, and increase the amount of vegetables. Also, there's a high stress on reducing the amount of alcohol and quitting smoking to reduce the incidence and prevalence of colon cancer.
Who in the general population would benefit from a colon cancer screening?
Yeah, the highest benefit is for people between 50 and 75 years of age, because that's when most colon cancers are found. Those over 76 should also benefit if they are healthy enough to undergo treatment for cancer. Other population which is especially important is the people with family history of colon cancer or certain inherited syndromes, and they should definitely consult their doctor regarding screening.
All right, Dr. Mehendiratta, I have to ask you this question because I know people are listening to you and thinking, you know, I really should schedule that colonoscopy, but I don't want to do it. What can you tell people about the colonoscopy to maybe make them feel more comfortable? If we can get one person watching right now to say, okay, I'm going to make that appointment tomorrow, what advice would you give?
Okay. Although the procedure is often identified by the vigorous bowel preparation it entails, colonoscopy does actually save lives by reducing and by finding precancerous polyps and having the ability to remove them. Colonoscopy is a very safe procedure, and it's commonly done under sedation. The doctor can look at the entire length of your colon with a flexible tube, has a camera at the end. Only takes about 15 to 20 minutes and has a very low risk of complications. So if you are over 50, you should talk to your doctor or gastroenterologist about scheduling a colonoscopy.
All right, well said. We thank you so much, Dr. Mehendiratta, for sharing this important information with our viewers.